So today's going to be a quick introduction into the bariatric surgery process that you decided to go ahead and start. First, I wanted to thank you for taking the time to look into our program, and we're going to do our best to kind of give you a quick overview of what to expect on this journey that you started. So first off, welcome. We're very proud of our bariatric team. We've been in practice for several years now, and our job is to help you get control of your life and be healthy. And this can be a very tedious and long process, but like anything that's worthwhile, there's a lot of effort that goes into it, but the rewards can be quite amazing. Today we're going to talk really about the steps of the bariatric program, the things that we have to do to optimize our patients, to get clearance from surgery, to educate them for long-term success, and to really understand the whole process and how to handle it well. So really, there is a bariatric contract that we want our patients to sign, and that kind of is a way of just making an agreement that we're going to try to help each other, and we both are going to be responsible for improving the quality of life in our patients. So again, there are some responsibilities that fall on to you as a patient, and part of that is going to be helping to verify your insurance benefits and coverage. There are several referrals and testing and procedures and orders that are going to be done prior to scheduling you for surgery, and those are some things that the office will help you with, but ultimately the responsibility will fall on you. Also, we want to make sure that you do develop a relationship with your insurance provider if you are using insurance, and making sure that the people that you go to for the various testings, blood work, are going to be covered, because sometimes insurance do require going to a certain facility. And again, we will do our best to help you coordinate that, but ultimately, as a patient, you're going to have to be an advocate for yourself as well. So there is a checklist that we have to follow, and you will be giving a checklist for the bariatric surgery requirements at your initial visit. Today is kind of going to be a quick overview to talk about what to really expect. So again, once we receive an authorization and everything's done, that's an exciting day, and that's where we pick a surgery date. But again, everything on that list has to be completed prior to doing that, and there's multiple reasons to go through all these things. Not only do we want to make sure that you're educated as a patient, that you're understanding of the changes that we're going to be to you, but we want to make sure that everything's done correctly and right, so on that surgery date we don't have any issues. This is a long process, and sometimes it can be anywhere from a 3-month process to a 12-month process, and a lot of that depends on the requirements that your particular insurance plan has given to you. But in summary, we really want to make sure that, number one, you have a one-on-one opportunity to meet with a dietitian, and we make a customized plan for you, because a plan for you may not be the same plan for another patient. A gastroenterology consultation, since we will be altering the gastric anatomy, the anatomy of your stomach, we do want to make sure that that's a healthy stomach and there's no issues there. So part of that usually means having what we call an EGD, or an endoscopy, and that's where we place a camera in your mouth, into your esophagus, and evaluate your stomach. Sometimes that can be foregone by having something called an upper GI. An upper GI is a study where you drink some contrast material, and we see how your body functions and how your stomach anatomy is. Again, after having that initial visit, you'll have a follow-up visit with the gastroenterologist to go over the results. In addition, we want to do blood work, and this can be a very important part of the process. So some people have issues with their thyroid. They have underlying medical conditions that are contributing to their weight gain, and those things have to be addressed beforehand, and we have to see where we're at. So the blood work that we do is usually fasting for 24 hours, and we'll go over that with you as well. Psychological evaluation and clearance, in addition to optimization, is very important. Mental health is a very important part of our bodies, as well as our physical health is. So we want to make sure that all of our patients have options, they have support, and they have screening, and any issues, any psychological problems that we have need to be identified and optimized prior to any surgery. In addition, we want to focus on physical therapy evaluation and giving our patients an exercise plan. People have different limitations. What your limitations may be might be completely different from someone else, but something has to be done. All of our patients have to take accountability and work within their abilities. Cardiac clearance, medical clearance, pulmonary clearance, all these things are a independent factor that has to be considered for every patient, and that will be determined on the one-on-one consultation that we have. And also repeating hemoglobin A1C levels, which is a marker of how well your body can control its blood glucose levels, is important, especially if you're diabetic. Nicotine levels, very important topic. Patients that do smoke and inhale products we know have a higher risk for complications. So in order to qualify for bariatric surgery, there can be no tobacco use, and that's something that we'll educate our patients and work with them to overcome. So what to expect on your initial nutritional visit? Well, the goal is to make a specific plan that's going to work for you. Okay, and depending on your insurance program requirements, it's either going to be 3 or 6 months of consecutive dietitian visits. And again, the role is a couple things. Number one, we want to educate our patients. Number two, we want to assess them. Where are you doing things that are right? What can you be doing better? How can we educate you? So having these nutritional visits are very, very important. Many times they're covered either fully or partially by insurance, but we need to make sure that we meet the requirements of your insurance. So we have to keep the appointments because we need consecutive visits to track progress. So again, keeping track of these lists that we're going to be giving you is very important. We have a lot of helpful ways to help you. There's an app we have called Bariatric that's going to help with all that. But again, take accountability for yourself as a patient, and we will help guide you through this very complicated process. So gastroenterology, again, this is a very important step in the surgery process to evaluate the anatomy of the stomach. We want to make sure that there's no issues, there's no infections, there's no problems with the stomach, so we can basically make sure that there's no problems that have to be addressed at the time of surgery outside of bariatric surgery. So again, blood work. The goal of the blood work is to make sure that we understand how healthy our patients are, and once we identify that, we can see what we have to work on. So some patients have no idea that they're diabetic, they're pre-diabetic, they don't know what their glucose levels are, they don't know what their thyroid levels are, and any issues that we can see in the blood work have to be evaluated, assessed, and worked on, so we decrease any possible issues at the time of surgery. And again, you should be fasting for the blood work, nothing to drink after midnight, and also you want to stop all vitamins and minerals the day before that blood work is drawn. Again, we're going to go over this, but good overview. Psychological evaluation and clearance. So insurance providers require psychological evaluation and clearance prior to surgery, and the goal is to really assess from really a psychological perspective whether there are any barriers that are going to interfere with our patients having the best results. So again, we have a great team of psychologists and psychiatrists that will review your weight and dieting history, identify any disorders, and really give you the tools you need to overcome any issues. Also, we want to work on evaluating your motivation, awareness, ability to understand what your limiting factors can be, and how we can improve everything with having a great, positive, healthy mind. And we'll help you identify a good psychologist or psychiatrist for that clearance. We have many great providers in the area that we use. So physical therapy, evaluation, and exercise plan. This is the next step. Now, sometimes people have a great sense of where they are physically and what they can do and things that work for them, but many of our patients have never really spent quality time in a gym or with a physical therapist. So the goal of a physical therapy evaluation is to see, number one, how we overcome any limitations you may have, and number two, how we can educate you to take your physical health to the next step. Because again, not only do we want to lose weight, but after the weight's gone, we want to maintain it off. So figuring out what your limitations are, working around those limitations are very important, and that's a benefit of a physical therapy evaluation. So prior to surgery, you'll have to go through medical clearance by your primary care physician, and that's to ensure that your body is healthy, and we want to make sure that your risks are assessed, so at the time of surgery that we don't have any surprises. So by making sure that the heart, the lungs, the body is optimized with your medical doctor. The goal is to avoid any complications from surgery, and we work together with your primary care doctor and with all our different specialists to make sure that you have a great, safe surgical journey. So the surgery clearance by a specialty physician. So again, if we need clearances, such as patients that have issues with their heart, with their lungs, or depending on what kind of problems that they may have, we may need to get additional clearances such as cardiac, pulmonary, or other type of clearances. Again, this will be a per basis, per patient evaluation clearance, and many of our patients do not need this, but any issues that we have with our bodies, we have to address them. We want no surprises on the day of surgery. And again, repeating blood work, specifically hemoglobin A1C levels, especially in our diabetic patients, can be a very important thing. We know that patients that have elevated hemoglobin A1C levels are at higher risk of having complications. So everything we do from the time you walk in here is trying to assess how we can overcome any issues you have and how to optimize and overcome any problems. So by decreasing our resistance to insulin and actively aggressively working on diabetes management in our patients is very effective in having good quality outcomes. And again, lastly, nicotine blood work. If you're a current or former tobacco user, you have to stop at least 6 weeks prior to surgery. This is both an insurance and program requirement. And the reason is simple. Patients that smoke have very low oxygen levels when they smoke, and their carbon dioxide levels go very, very high. And in a patient that's recovering from anesthesia and healing, low oxygen levels can lead to high risk complications such as a gastric leak, which is preventable. So nicotine levels, again, are checked, are assessed, but there's a lot of options out there that we give patients as far as pamphlet support. There's medications, so we'll help our patients overcome this. So ultimately, we really have to communicate. We want to develop a great relationship with you as a patient, and we have plenty of ways to do that, okay? So you can see there's multiple steps to going through this process, and it's very important that you as a patient communicate with us when something is done. When you get your endoscopy done, reach out to us. We have a great app called Bariatric, which is an app on your phone that we can reach out to you, and you can reach out to us, and we'll remind you about appointments, and you can tell us about how things are going. So communication is very, very important, and our job is to continue to motivate you to do well, because we want you to do well, but we won't do it for you. So this is a thing that we have to say. We will work together as a team. You're not alone. So communication goes both ways. Again, contacting us, we have a team email, we have Bariatric, we have phone, obviously in the office as well, that we can reach out to. But we find Bariatric as a wonderful tool for our office to communicate with our patients. So really, what's the next step? You're going to get a specific list of your requirements. This is a very overwhelming thing in the beginning. We will break it down and make it simple for you. Again, allow a couple weeks to receive phone calls from your providers for the referrals that you're getting, and keep any appointments that you have scheduled. Do not cancel, do not show up unless you need to, and continue to do research about your bariatric surgery. It's important too that you review the literature that we give you. We have a wonderful bariatric manual that's always changing, that kind of goes over all the things to look forward to, expect, and prepare for. And we have a wonderfully knowledgeable bariatric staff that will help you with this whole journey. We're here to encourage you, we're here to push you, and we really want you to do well. And we do have monthly support groups. And again, don't hesitate to contact us if you're having an issue. There's multiple websites and things on the internet that can help on this journey. Be cautious on what you choose, however, because there's some great sites out there and some questionable ones. These are two great sites, asmbs.org and obesityhelp.com. We also have a great social networking team. We have a wonderful, wonderful online Facebook group, Even if you're not in the Facebook, it's a great platform where patients get on, share their ups, their downs, their stories. It's very motivational, and we're very proud of that. We also have a YouTube page, an Instagram page, and a TikTok page where we love to show our patients off. So again, social media is a great tool that we use to kind of keep in contact with our patients. So thank you for joining the program. We appreciate you, and we look forward to seeing how you do.